The lockdown mental health crisis. Let's have a look. Hello everyone, Florian.heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee because we're going to talk about an article from the Daily Telegraph that covers, quite a concerning topic, discussing, the impact that the lockdowns and COVID and everything's having on young people's mental health. Now, before we go into this, I want to, as a YouTuber, just to encourage people, if you are suffering mental health issues, to not be afraid or embarrassed or ashamed to pick up the phone and try and get some support. There's lots of organizations you can find, lots of places you can call, and we're about 80% male audience here. Blokes, you need to do it too. It's not emasculating to try and get help. It's sometimes necessary and it's important to do. Dark times pass and good times will eventually return. It's really all I can do as a YouTuber is to encourage people to take that step if they're feeling in that situation. And if you know someone, maybe reach out to them. I mean, I know it's hard when someone's completely in the dumps. They don't want anything. You don't even want to interact with them sometimes if they're so negative, but you need to at least reach out to them and help them, at the very least. With that out of the way, let's have a look at this article because it is certainly one of the concerns that many people have with regards to this whole disaster. So, Tia Sweeney shares how COVID is impacting young people's mental health. The number of suicidal, self-harming teens presenting to emergency departments has increased by almost half since the pandemic, prompting calls for more mental health funding. So, when Tia Sweeney told emergency department nurses she wanted to end her life, they sent the teenager home with a sedative. Well, what else can they do in the ED? 3 weeks later, when the 18-year-old woman was admitted to Sutherland Hospital Emergency Department threatening suicide, she was again sent home and told she would be better off in the community. Miss Sweeney's situation is becoming increasingly common among young people who are bearing the brunt of the COVID-19 induced psychological and economic hardship. That's right, everyone. It's not uniform. It's the younger generations that's copying it more. A lot of them are the retail workers and the students that are in the businesses that are shutting. The number of 12 to 17-year-olds presenting to the ED with self-harm or suicide ideation has increased 47% in the year to July 2021 compared to 2019. The increase was only 17% across all age groups, according to New South Wales Health. So there you go, guys. This is affecting young people more than anything else. Sorry, that was a call from Albania, of all places. Are you guys getting those scam calls all the time? If someone calls to you and say they're going to arrest you, or the robotic voice saying they're taking down your internet, it's bullshit, guys. Don't believe any of it. I'm just going to put this on silent mode. Such a professional operation here at HeiseSays. ED departments in the Sydney's Children's Hospital network, Randwick and Westmead, St Vincent and Northern Sydney, have been the city's most impacted. In the year to July 2021, those hospitals have seen increases of between 42% and 211%. Wow. In 12 to 17-year-olds presenting to ED with self-harm or suicidal ideation. Miss Sweeney suffers from obsessive-compulsive disorder, depression, and post-traumatic stress disorder. I mean, this is it. The lockdown is just going to exacerbate mental health issues that people have. While she has suffered from mental ill health since the age 10, she said the past 18 months have been by far the hardest. I believe it was brought on by the COVID lockdowns and that I have been cooped up for so long, she said of the past 2 episodes, for which she is receiving treatment from a private physician. And I would say the majority of the problems I had during my HSC were because of the lockdown last year. I can't imagine these school kids going through HSC and all of this stuff. It's meant to be, party times. You finish high school, you're about to go on to uni or to something new and exciting. It's a great big party. The world's your oyster. Poor kids. I actually kind of stopped going to school after the 2020 lockdown. These are meant to be like the best years of your life, finishing high school and your first year at uni, but I'm in lockdown. University of Sydney Brain and Mind Centre Policy Co-Director, Professor Ian Hickey, said young people's social and economic well-being is the most likely to be adversely affected by isolation. He also said many parents in affluent northern and eastern Sydney areas don't take no for an answer and are presenting to EDs because they're unable to get services elsewhere. They want access to an effective service, and they will keep coming back in an attempt to protect the life of their children and to seek services, the professor said. And they expect the public sector system to respond appropriately. And I mean, even in the discussing mental health issues here on the channel, people have mentioned in the comments that the service that they've gotten from some of these providers wasn't exactly up to scratch. And I mean, don't let that stop you from trying to reach out to one of these organizations. I mean, they're getting government money anyway, guys. Put in the work, you know? Put in the work. Bloody hell. Bloody oath. So, New South Wales Emergency Department self-harm or suicidization ideation presentations in 21 to 2019. So, what? 0 to 11 years old. Kids. Children. Babies. 205. 12 to 17. 7,501, up 47%. 18 to 24, 7,086, up 13%. 25 to 34, up 10%, 6,134. 35 to 64, up 9%, 10,277. 65 plus, 1,612, up 16%. Look at that, 47%, everyone. That's just crazy. That's just crazy. And this is 2021 versus 2019. Everything up 62%, 59%, 56%, 52%, 51%, 48%, up, oh boy, up 47%. Some of these hospitals, some of these areas. Professor called for the same urgency around mental health services that we now have around the deployment of the vaccine. Well, yeah, yes, you need to. If you've got this many thousands of people presenting to ED with this is dangerous too, guys. Look at these numbers. The logistics of putting services on the ground requires serious coordination now, and that will require redeployment of workforces, not just commitments of money, the professor said. A Sutherland mental health service spokeswoman said their services include but are not limited to acute community mental health care by an acute community team providing intensive treatment for a person in their own home. A suicide prevention outreach team works closely with the acute care team for consumers that require extra support for suicide risk. In addition, the Sutherland Hospital Mental Health Service also include adult and young community mental health treatment teams, a child and adolescent mental health team, and an older person's mental health team. The Sutherland Hospital Mental Health Service has a 28-bed acute mental health unit for consumers requiring intensive inpatient mental health care. And if you need someone to talk to, you can ring Lifeline 13 11 14, Beyond Blue 1300 22 46 36, and Kids Helpline, I'll give that one too, 1800 55 1800. So, there you go, guys. Another part of the price that we're paying for all of this. And something I'm concerned will probably be swept under the rug more than anything else. This needs to be brought to attention, and good on this girl for speaking about these issues in public. That should be commended. What's the solution, guys? Well, the one thing is, don't try and fight this battle by yourself. That's the one suggestion I would give you. But, resources they're right, something needs to be done. This needs to be considered. But you can understand why they don't want to, this is just ideation too and reporting to ED. You can understand why they don't want to talk about people who go through with this. They don't want to give it the attention. But it is disturbing. Anyway, Let me know your thoughts and opinions on this topic, as depressing as it is. Please like, share, subscribe to the channel. You know how to support us. If you need help, reach out to it. Take care, everyone. I'll see you next time.